Hi, good afternoon, everyone. My name is Dr. Gauri Kulkarni, and I head the medical operations at MediBuddy Docs app. And today we are going to talk about how we can take care of the elderly in our family during this COVID era. By WHO's definition, elderly is anybody who is above the age of 65. The early elderly is between, say, 65 to 75, and the really old people are about 75 years. Now, as the age expectancy has definitely increased, right? We know that there are a lot more of older people around us who we are taking care of, our parents, our grandparents, in some for some people even their great grandparents, right? And these and we have been told time and again that older people are more at risk of getting infections. They may have multiple other problems, and that can lead to difficult consequences, and hence it's important that we talk about their issues, right? So please come forward, ask your questions if there is anything in specific that you would want to know, and I'll try to answer them. In the meanwhile, I'll take you through what we can do when we have older people at home, right? How we can ensure that they are in optimal health, how we can ensure that we can help them so that they have a fantastically productive lifespan, a wonderful time, even though in the midst of the COVID era where they are most of the times indoors, right? So, to begin with, right, as I was mentioning, that older people are those who, tend to have a lot more issues, right? So I'm sure that you have maybe parents or grandparents at home who are already suffering from multiple physical health or chronic health problems, right? So a lot of times people have, say, diabetes or sugar problem. People have high blood pressure issues, heart issues, issues related to the lungs, something called as COPD, or many a times, issues with the kidney or the liver metabolism. So there can be multiple issues that people in the older age group bracket can have, right? And it's very, very important that if you already know that somebody in your family, an older person in your family, has any of these illnesses, right? It's extremely important that we know and are aware of what we need to do for this, right? Now, there are simple steps that we can do, right? One is to ensure that they are on optimal medications. Are they taking their medications on time, right? So it's a good idea for you to, if you're going to help somebody at home, right, who has a chronic disease ailment, to ensure that you have all the medications written in one place, right? Maybe you could just write it and then stick it up on the wall so that everybody knows, because it's possible that there can be more than one caregiver in the house, right? And hence it's important that everybody knows the whole history. So it's a good idea to have a list of all medications and ensure that they are taking all the medicines on time. Most elder people are self-sufficient. They're able to take medicines and remember and take it. But if you think that there is an element of forgetfulness, or people are not able to remember and take their tablets effectively, then it's a good idea for you to administer it yourself, right? Giving it to them. The other thing that you can do in terms of people, older people who have chronic disease, I think it's very important. Maybe it's an idea that a lot of us use. I use at home personally, is using a pill box, right? So that a pill box is like box with the days of the week written, and you can actually put all the medicines there, so that every day they don't have to think too much before taking the medicine, right? They have to just open according to the day of the week and then have the medicine, be it in the morning or the afternoon or night, whatever is their schedule, right? So that really helps them to be more self-sufficient and more confident about taking medications, right? So the first thing is that if you have an older person at home and you know that they are having any specific physical health ailments or chronic diseases, ensure that their medications are taken on time, whatever those medicines to begin with, right? So help them and ensure that they are. If they are not taking, find out what is the reason and help them to circumvent that. So which means if they are forgetful, you administer it. If they have side effects about of medicine, then you ensure that you talk to the doctor and get the medications changed or do something about it. You cannot just stop a medication without talking to the doctor, right? So it's important that you take care of the chronic disease by ensuring that medicines are taken on time and proper follow-up is done with the doctor. That's the second point that you have to do. Ensure that You talk to the doctor over phone. These days it's absolutely available. You can talk to a doctor, your treating physician on the phone, or you can take a teleconsultation and do a regular follow-up. Maybe in some people may require monthly follow-up, some people require say once in 3 months follow-up. Whichever the case, right? Ensure that you are following up with your treating doctor regularly. How does that help? The doctor can ask you specific questions about, say, side effects of medicine or about any long term consequences about, say, the disease, chronic diseases that they may have, and then accordingly advise you correctly, right? So there's a good touch base that you can keep with the treating physician on a regular basis. That really, really helps. Of course, when you do this, you will also know that the physician will tell you that you need to get some tests done regularly, right? For example, say if your parents or grandparents have a sugar problem or diabetes, the doctor would say that once in 3 months do get your sugars checked. Say do a fasting blood sugar or do a glycated hemoglobin or HbA1c test done. So ensure that you are doing these tests, right? Certain tests can be done once in 3 months. There are certain tests that should be done once in a year at least, like for example, say kidney function tests or thyroid profile test or checking how the cholesterols are doing. So these are things that need to be checked according to what your doctor would ask you to, but ensure that those are done, right? So first is to ensure that medications are taken on time, ensure that proper follow-up is done with the doctor, and third is definitely that you should ensure that tests are done at the right time, right? How does this help? Why are these things important, right? They are important because it helps us to um, keep one step ahead of the disease, right? So, see, with any chronic disease, it's important that who is in control. Am I in control or is the disease in control of me, right? Am I controlling the disease? Yes, you can. If you ensure that medicines are taken correctly, follow-up is done correctly, regular tests are done according to the prescription is done, then of course you will be able to take care of the disease better, right? You'll be in control of the disease better. But if you don't do this, there's always a chance that there could be something happening, say a consequence, a side effect, a complication because of the disease, and that can make things difficult in the long run, right? So any elder person that you have at home, and if they have already have a chronic disease, ensure that at least these three steps are taken care of, right? That's to begin with. Now, if you have an older person at home and they don't have any chronic diseases, and that's wonderful, right? I congratulate you that they have been able to keep their health well, they have been able to take care of themselves so that they don't have a chronic disease. Even in such cases, also, it's important that you touch base with a physician at least once a year. Ensure that you're doing certain basic sugar cholesterol tests done once a year. It helps, right? So, from a chronic disease perspective or from a disease perspective, these are good. Now, you would also have older people at home who are very commonly talking about aches and pains, knee pain, arthritic problems, unable to do walk or unable to do their regular activities, right? And if something like that is happening, it's a good idea for you to get to the doctor. A lot of older people are deficient of vitamin D3, maybe they are deficient with calcium. It's a good idea that these are checked and supplemented correctly, right? So if you do that, it helps. It helps to, in the long run, to ensure that their bone health, their muscle health is well and they're able to do their regular activities, right? Because our goal is to ensure that our older people at home are as independent as possible, that they are able to take care of themselves with least intervention from our side, right? So these things will help, right? So ensure that if you have an older person who's talking about aches and pains, tiredness, it needs to be get evaluated. A lot of times, vitamin supplements help if they are deficient, right? So that is something that you need to take care of. Now, I know that a lot of older people also have issues such as, difficulty in walking, or they have tendency to fall quite a bit because they don't have there's a gait problem, or they may not be able to hold things correctly, or they tend to fall, right? Falls are very common in older people, and this can be because of many reasons. It can be because of aches and pains or joint problems, it could be because of coordination problem, it could be because of eye problems. There could be multiple reasons why falls happen, right? It's extremely important for all of us to take care of older people when at home, right? Falls typically happen, say, in a bathroom, or falls happen in, say, if there is a loose rug at home, which is kept under the feet. So these things have to be looked at. Give them enough physical aid to help them be more independent. So it could mean, say, a walking stick, a four-pod walking stick, or a Zimmer frame, which helps them to walk, or enough place in the house to hold, right? So holding aids where they can hold onto a bar, so that they are able to walk, especially say in a bathroom. It's a good idea to have that. So our aim should be, as I said, to keep them as independent as possible and give them the aids that will help them to be more functional and more productive for themselves, right? So yes, so one of the things is, as I said, aches and pains. The other thing is, like, falls. Now, I have also seen a lot of older people who tend to have, because they have multiple health issues, say they may have a kidney problem, heart problem, sugar problem, blood pressure issues, बहुत सारी चीजें एक साथ हो जाती हैं, right? And many times what happens is that they will visit different doctors, right? कि cardiologist से भी मिल लिया, nephrologist, have a treating physician, diabetologist है. What happens in such cases is that many a times there are different medicines that are given. Too many medicines are there. It's called polypharmacy. When there are too many medicines, it can be an issue, because a lot of medicines, they usually interact with each other, right? So it's a good idea that you have the history. If you have an older person at home, or you say your grandparents are there, it's a good idea कि आप एक एक कंसाइज हिस्ट्री बनाइए, और एक ही जगह पे सारी चीजें लिख के रखिए कि इतने सारे मेडिसिन दे आर टेकिंग, so that when you go to any doctor, the doctor would have a better picture of what all drugs are going, right? And it's a good idea to tell everything up front, right? So it's okay for you to tell, this is the medicine that was given by, say, my diabetologist, when you go to a cardiologist, because there should not be a repeat of drugs happening, right? क्योंकि आप ऑनलाइन जब कंसल्ट रहते हो, बहुत बार ऐसे होता है कि मेडिसिन की सारी हिस्ट्री नहीं जानी जाती है, और ओल्डर पीपल में ये बहुत कॉमन है कि बहुत सारे मेडिसिन साथ में दिए जाते हैं, राइट? एंड दैट कैन बी एन इश्यू. See, medicines are provided so that it helps to get better, but it's also very important for us to understand that you cannot keep on taking, say, maybe if two doctors are giving the same medicine, then it can be a double dose, which can be a problem. So it's a good idea ki you have the whole history in one place, and you have all the tablets that they take on a regular basis written very clearly somewhere, right? It helps not only the older person at home, but it also helps when you're following up with your doctor, right? So avoid polypharmacy, which means multiple drugs given. They have to be taken if they are required, but ensure that same drug is not prescribed by two doctors, right? Usually that happens when we do not divulge information. हम सारी information अगर हम नहीं देंगे तो naturally इसमें problem हो जाती है. So ensure that you have it written somewhere. It will help the older person in the long run, right? Now, a lot of people, have asked questions about diet and exercise. See, we need to understand that these are all very important points. Exercise has to be done as much as is possible, right? As age advances, of course, many people find it difficult to exercise. That doesn't mean that we should be ageist. We have a lot of older people who are extremely fit, who are extremely, you know, um, uh, uh, you know, uh, health conscious and exercise conscious, and they can do a lot more than maybe young people as well, right? But it's important that exercise is a consistent part in the day-to-day workings, right? It has to be there. Why is it so important? Because it will help in having a great, ensuring that bone health is kept well, a great muscle power is kept. Because a lot of times muscle mass loss happens as the person grows old. So that's why health exercise is extremely important in older people as well. Whatever works, right? Start with the least, and then you can go up. Sky is the limit, but at least start with the basic, right? Basic walking, basic, say, maybe they can do yoga, and everything can be assisted also. It's not that you need to do the most advanced form, right? Start with basic, but it has to be a part. Ensuring, see, when can they exercise? When they don't have any aches and pains, right? Typically what happens, most older people do not exercise because they have a knee pain or they have body aches and tiredness. So you have one, we need to ensure that that is taken care of, so if they have to take some supplements or they have to be on vitamin D, then that has to be given so that they are able to exercise well, right? So this is very important. I tell all my older patients that it is extremely important that they keep themselves mobile, right? When I say mobile, they should move around. Now, what has happened is with the COVID scenario, naturally there is a lot of restriction to movement, right? Earlier, we would have, um, older people going, say, to the park and, taking a walk and, having some time, but good time together for and spending some quality time with their friends and all, but that may not be possible in the current scenario, considering COVID is around. Why? Because COVID is known to cause much more serious complications in the older individuals and also individuals who tend to have multiple health problems, such as say, diabetes and so on and so forth. So it is important for us to understand that what can we do considering the COVID situation, right? How can we ensure that some form of exercise is done at home? So I give, say, a couple of ideas that I always tell is inside the house itself, right? At least after every meal, right? So you may have a breakfast, you may have a midday snack, or say the lunch, and then you have a mid-evening snack, then you have a dinner. So say maybe you end up having, say, 4 to 5 meals a day, usually in the in small quantities. Ensure that after every meal, you're at least pacing in the house for, say, about 5 to 10 minutes minimum. This is bare minimum, right? How does that help? Because it helps in metabolism, and there's some amount of exercise happening at the same time at a pace which you are comfortable in, right? You do not have to push it, but it's a good idea for us to let our parents or grandparents know that they can do this, right? Even in the house, this it's the bare minimum that we can do. Of course, there are so many other things that we can do. You could do pranayama and yogas on a daily basis, pilate, and all of these can be assisted, right? There are a lot of groups which do chair yoga, and then there are groups which do assisted pilate with the use of some certain props, which makes it easy for older individuals. So these are all things that can be done to keep oneself fit, oneself mobile, but at the same time being at home, right? I personally still tell that individuals who are in the older age bracket should avoid going out even now, right? So avoid crowded places, avoid places where there is which is ill ventilated, because yes, there is always a chance that we can pick up the COVID infection and we do not know where it is coming from, right? So it's very, very important that we be mindful of this, right? We have to be mindful. Of course, there are people who have reached out to me saying that there is no way, I can't help it, I have to travel. And I say, well, if you have to travel or you have to get out of the house, then ensure that you are taking all preventive measures, wear your mask, keep sanitizing your hand, don't touch surfaces too much, keep your physical distance from other people around you. So those are the things that we have to follow, right? There are no two ways about it. But when it comes to an older person, it becomes even more important that we really, really stick to it at all times, and preferably avoid going out if it can be, right? So we did talk about a bit of physical, in terms of the physical ailments that elder people have. And one of the things that is coming up these days is definitely mental health issues, right? We typically talk of mental health issues in the more productive age groups, where people are going to office, they have work from home, and it becomes very difficult to manage a lot of things from home, and there people are finding it difficult from the work life balance perspective. But the older individuals or elderly people have also shown a rise in depression, a rise in anxiety. And this has to do a lot with the worries that they may have regarding the disease itself, the worries that they have about their family members, and about what would happen if something goes wrong, or if they are infected with the virus, with the COVID-19 virus. So we have seen a rise of mental health issues even in the older people. So as an individual who's a caretaker, like I have, say, maybe my parents or elderly grandparents at home, it is important that I recognize this, right? It's important that we all recognize uh, in our, within our environment, if there are older people and if they are having any issues, then it's very, very important that we take care of them. We talk to them more often, be connected with them. I know that in many places that excuse me, I know that in many places uh, people are living apart, right? When I say that, say parents are in another city, you are working in some other city, so there is a distance there, right? So it's very important that you keep in touch. You do video calls, you do virtual connects. It's not stopping us from being social, right? So though there is a COVID-19 infection going around, doesn't mean that we can't be social. We can be social virtually. Ensure that with older people we are doing this even more, okay? Because they tend to not express themselves well. We have a lot of our, and I think many of you would second that older people tend to tell us, oh, we don't want to disturb you, oh, we don't want to take up your time, we don't want to put you into trouble. These are the things that they very commonly say. But and that's the reason why they don't come up and talk to us about their symptoms, right? If they're having any problem also, they would not come up and tell. So it becomes the caretakers, or proactively we as individuals who are taking care of older people, we should be the ones who reach out to them and ask if they have any issues, if they would want to talk, and hold open discussions with them, because this is extremely important. Older people tend to not talk, okay, and that's because they have, they think like that they may not want to disturb people. But if they do get something, then it becomes a problem. So ensure that you are in constant touch with your parents, with your grandparents, with your uncles and aunts, and whoever there is around you who need that emotional support in this time where physically meeting might not be possible, right? So ensure that you are more communicative, you talk more, you discuss more, be available for older people. So it's extremely important that we take care of their mental health as well, okay? It's not talked as much, but I think it is a very relevant thing, and we should be mindful of this, okay? Another thing which we have seen with older people is also forgetfulness. I'm sure that a lot of you have heard about dementia, Alzheimer's disease, especially the most common form of dementia is Alzheimer's. So a lot of people in the older age group, right? So say people who are 65 plus and even beyond that as well, the really very elderly, like above 75, they tend to have forgetfulness, like most of us, even the younger people also, but the older people tend to have that more because of a degenerative process. It is something that happens with age. Now, if somebody is forgetful and somebody has been diagnosed specifically with dementia or any form of dementia, it becomes even more important that we take care of them, because they may not remember all the time. Say, a lot of times people who are suffering from dementia tend to say walk out of the house without telling, or they may not wear a mask, they may not be able to follow precautionary measures. So it's extremely important that people who have forgetfulness, or they have elderly, rather, if you have older people at home who may have forgetfulness, specifically any form of dementia, they may require add-on assistance or help. See, even if all of this is said, many a times I also say that not everything can be done by ourselves, right? And help might be required. And it's okay for us to say seek help in terms of, say, either be it, say, doctors who are helping us, or say nursing aides who might be helping us, or just having a house help who could help in taking care if there is an older individual in our family who requires a lot more assistance, right? If there is an older person in the family who is, say, bedridden, who say somebody who had a stroke and is now bedridden, or somebody who has any issues and they are not able to move out, naturally it can be quite um, overwhelming to take care in such situations, right? Physically also, as well as mentally also. And it's important that if you are a caregiver to such an individual, ensure that you seek help, right? Seek help in the form of, say, having a help at home, or somebody who can come home regularly and visit, or say, take care of them. Now, because we usually tell in COVID it's best to avoid any visits, right? It's okay if you can say talk to a doctor on a phone, if there is any specific change in medications that can be done, and it's easily done with, say, a video consult or something like that. Try to adopt that. I mean, I would sincerely request all of you to be in regular touch, right, with your doctors or your counselors or any therapist who are taking care, right? Because many of these people might also require, say, physiotherapy, may require nursing aid. So we have to do what we can do in the current scenario to the best of our knowledge. If you have a help who's coming home to take care, then ensure that the person is following all precautionary measures, right? Be it, say, washing hands and sanitizing and wearing a mask all the time. All those things have to be done so that we prevent any spread of disease to the elderly individual who's being taken care of, right? So those are extremely important things that we must follow. We must follow when it comes to older people, right? The other thing that I usually say is, and I keep insisting on, is regular monitoring, right? Now, regular monitoring and regular follow up, I think, are very, very important when it comes to older people, because they do tend to have, most of them would have some or the other um, chronic diseases, right? So monitoring can happen even at home, right? So which means that, say, a sugar check at home, or a blood pressure check at home, or a oxygen saturation check at home, or whatever these things are there, and then you could follow up with the doctors regularly, right? But that really helps to ensure that everything is taken care of, um, quickly, without any, without waiting for anything complicated to happen, right? Having said that, there are individuals who would require, say, a hospitalization, right? Be for any reasons, be it for, say, for a non-COVID reason, or God forbid, if there is a COVID infection also, they may require. In such cases, please do seek help at the right time and get them hospitalized if required, because it's better to have a structured hospital care rather than caring at home if the situation demands it. Like, and it's the doctor's decision to understand the symptomatology, understand how, what is the stage of illness, or how difficult the illness is, that can it be treated at home or not, and accordingly the doctor would advise the right thing to ensure that we give the right care for our older people who are at home, right? So it's very, very important that we do ensure that these things are you know taken care of. Okay, so in terms of, I think, from a elderly care, as we said, right? So it's the chronic disease management, taking care of medications, taking care of lab tests, ensuring that we take care of regular follow-up and regular monitoring, and look at symptomatology, right? So look at symptoms. Is there something changing with the older person at home, right? So it could be a physical change or a mental change, as we talked about the mental health. But the physical change could be like, are they sleeping a lot more, or they are just passing too much to, they're going for frequent urination or frequent trips to the bathroom, or they are having a tummy upset, or they are not eating well, or anything, any change. I think it's a good idea for us to seek help in such situations, because we don't know why it is happening, right? So I feel, in terms of the caring of elderly during this, this phase of COVID-19, one is to take care of the already present ailments, right? Any chronic disease that the person might be having. Two is to prevent any new complications happening because of them, right? Which means by regular monitoring, follow up, regular medications and labs, we may be able to prevent any complications. Three is to not allow anything new to happen, which means that you should be in constant touch with the doctor. If there are no health issues, then continue to not have it and not to develop anything. Four is to definitely following the right preventive measures that would be required to ensure that they do not get the COVID. So, which means that not stepping out, taking care of immunity, taking care of what happens in the home. People who are at home also, they need to take care of it, right? So, if the older person might not be stepping out, but if you are stepping out, then take care of that for yourself, because if you get infected, then most probably you will be passing it on to the other people at home, right? So those are the things that you should take care of. So ensuring that from a COVID-19 perspective, precautionary measures are taken. Four is to seek help early, right? Do not wait till the very end to seek help, right? So it's okay to pick up the phone, talk to your treating physician, take a teleconsultation, talk to somebody, so that if there is any problem or any change in the physical or mental health environment that you're seeing within the older person at home, seek help early, right? Seek help early and do not push it on, because that will only make things difficult, right? It will only make the things complicated. So seek help early on, right? Few things that you can do, and I'll repeat it, which will help you in the long run, is to ensure that medication list is created well, ensure that maybe you can have a pill box for the person, ensure that there are prevention of falls at your at home, by not having anything which will, to not having too many furniture, or not having any loose rugs, giving enough railings or aids for them to walk, so prevention of falls. Okay. And observation of any kind of new symptom that they may develop, with quick seeking of help through through any form of consultation with a doctor or a therapist or whoever that is required, right? So if you do these simple things, right, I'm sure that you'll be able to take care of your parents, your grandparents, and the older people at home much better, and they will have a much better quality of life. They will also have much better much better um, productivity in their regular day-to-day living as well. So take care of them, right? They are in the stage of life where they need our support and help, and we are here to give that to them, right? So take care of them. Stay safe, stay healthy, stay happy, and take care of yourself. Bye bye for now.